Just a second. I'd like to go back over to Dr. Rowe. You were there. You're in Tennessee. You saw this experiment. Even the Democrat governor said it was a failure. I'd like you to just finish fleshing. We have just a few minutes left. You could finish.
Let me sort of go over why it's important for the public and my patients and our as physicians, our patients, to understand this. What we're concerned about is if this plan becomes a public option, that's the only option. And the way that occurs is, I've explained, when the cost of the public plan does not pay for the cost of the care, more costs are shifted to your private health insurers, meaning that they'll eventually drop the plan. Now, having a single-payer system like Canada or England, is that necessarily bad? Well, I would argue that it is in America, and the reason is because it's going to limit choices. And I know it was brought up just a moment ago by the gentleman from Arizona about costs. And I'm going to share with you just a family practitioner in my own district the other day called me up, and he said, Bill, he said, I have had one lawsuit in my career. A very young woman that had a serious problem, probably not preventable. He had a grade by the insurance companies of what a good doctor he was, in the top third always. After this one lawsuit, and nowhere is a medical malpractice mentioned here, his referral to specialists in 1 year went up 350%. His lab ordering went up 550%. This is not him saying this. This is a grade he got from the insurance companies. So there's the cost side that we were talking about earlier. Then who knows, when you extrapolate that across the country, how much that must be. Now, I got this letter right here this afternoon from CBO to Chairman Rangel, 14th of July, today. And in this, it says, another significant feature of the insurance exchanges is that they will include a public plan that largely pays Medicare-based rates for medical goods and services. CBO estimates that the premiums for that plan would generally be lower than the premiums for private insurance. But on average, the public plan will be about 10% cheaper than the typical private plan offered in exchanges. And therefore, they're saying right here in this document that that's what's going to happen. Mm-hmm. The other thing about this I found interesting was this plan doesn't start until 2013. And what you're seeing here is only in the last 6 years, this $1.1 trillion plan, it actually is $150 billion per year is what it amounts to. It's not what they're currently saying it's going to be $1 trillion over 10 years. It's really $1 trillion plus over 6 years. I yield back.
The gentleman from Missouri.
Yes, let me just, I told Congressman Shattuck from Arizona, going to get him in. He had a couple of points, so we're going to jump over to you, Doctor, and we'll get right over to you. Yield to the gentleman from Arizona.
I thank the gentleman for yielding, and I'll try to be as brief as I can. I want to point out that the Democrats' bill was not the only bill introduced today. As many of my colleagues here know, we introduced the Improving Health Care for All Americans Act today. It's a bill that reforms health care, not top-down government edict, government mandate. It reforms American health care bottom-up. It controls costs by empowering Americans. And it has some key points. It says if you like it, you can keep it. It provides coverage for every single American and choice for every single American. It provides new pooling mechanisms so that you could be in an insurance pool other than your employer's pool. It says that the Kiwanis International or the Rotary International or the Daughters of the American Revolution or your alumni association of your college or university could sponsor a plan. So you could pick many pools to get into. It also says we are going to cover pre-existing conditions or people with chronic conditions at the same rates as everyone else by cross-subsidization and high-risk pools. But I wanted to make, because I have some charts here, 2 quick points very quickly, and I'd invite anybody else who speaks in the limited time we have left to comment on these, because I think they're so important. The President has said over and over and over again, if you like it, you can keep it. I think that's so important because polls show roughly 83% of Americans, 83% of Americans like the health care they have. So if the President stands forth and says, if you like it, you can keep it. Ladies and gentlemen, I wish it were true. This is the language of the bill which was introduced today. It's been revised and renumbered. This came from the working draft, but the same language is in the bill. It says, by the end of the 5-year period following the introduction of the bill, group health insurance plans, every group health insurance plan, must meet the minimum benefit requirements under Section 121. Section 121 creates a new federal entity called the Healthcare Advisory Committee, which will rewrite the minimum benefits for every health care plan in America. That means every health care plan in America under their bill will change within 5 years. Some will change immediately. Everyone will change within 5 years.
Reclaim my time. So what you're saying is, if you like it, you won't be able to keep it. That
if you like it, like the headline says right here, if you like it, if you like your care, if you're one of those 83% of Americans, be prepared to lose it, because you're going to lose it under their bill, not just by competition from the public plan. Their bill says you'll lose it in 5 years. Every plan has to change. We'll conclude very briefly on an issue that I know is near and dear to the gentleman who sponsored this special order tonight, our friend Mr. Akin, who's a cancer survivor. The American people, I hope, will slow down this process. I hope they'll say, we want to see what's in this bill. But I hope they'll ask this question and understand this information. We are being told to switch to a system similar to what exists in Canada, Europe, and England. Those are the parallels. But I would suggest to my colleagues and to every American, there are two things that scare every American. Those two things are cancers. For men, it's prostate cancer. For women, it's breast cancer. And these are hard facts. This chart shows you that the 5-year survival rate in the United States for prostate cancer is dramatically better than Canada. It is stunningly better than Europe, and it is shockingly better than in England. So if you have prostate cancer in America, your chance of surviving after 5 years are dramatically better in the United States than in the system the Democrats are telling us we ought to adopt. But that's not enough, because every woman in America goes to bed each night worrying about breast cancer, and I would suggest every husband in America goes to bed worrying about what breast cancer. And here are the facts. If you look at 5-year survival rates for breast cancer, once again, the United States, the system they want to throw out, you have a dramatically better, significantly better chance of surviving than Canada, even more dramatically better chance of surviving 5 years than if you lived in Europe, and even better than that of surviving 5 years than if you lived in England. Before we adopt a Canadian, a European, or a British system of health care, we better know that the survival rates for these cancers, the cancers that scare most Americans more than any other, are significantly worse in those countries than in the United States.
Would the gentleman